risk of getting a heart attack? Well, no one really knows what causes the artery to clog up that causes the heart attack or the muscle to die. But brainy bastards know there are risk factors or things which will help predict it. Like, for example, increasing age. It's very rare to get a heart attack under 30, you know. You can get it at 35. So risk factors include increasing age. Generally, men get them more than women. And then you start looking at things like family history. Generally speaking, if there's a history of early heart attacks in your family, you're at much higher risk of getting another one. Then when I examine you as a doctor, I could tell you whether your risk is high depending on your blood pressure, because the higher your blood pressure, the higher the risk of getting a heart attack. Other ones including smoking and diabetes, and overweight's one of them, but really it's the diabetes business. So again, I want to phase in to part of the Academy Award-winning Healthy Bastards movie, which was starring myself, Batman, and Ingrid Bergman. And I want you to have a look at this, talking about the risk factors, the blood pressure, the smoking. We had a top cardiologist talking to us. Do stand by and follow this through and see what you think. And then I'll come back to you, okay? Good on you, thanks. So let's measure Bob's blood pressure. Hello, Bob.
G'day, Dr. Dave.
Good to see you. So, why am I bothering to measure Bob's blood pressure? Well, the reason is simple. The higher your blood pressure, the higher the chance of getting a heart attack or a stroke, which is bleeding around the brain. So how do you measure it? Well, you use this gear here, which is called a sphygmomanometer, which is a little pressure reader in a cuff, which blows air up and cuts the blood supply off to the arm. And then with those different pressures, I'm listening for sounds, and I'll explain it to you. The important thing to understand is that when you're doing the blood pressure, you position this cuff properly. Put it over here, nice and tight. Does that feel all right?
Yes.
Nice and firm.
Oh, good.
And you put the stethoscope on. And I'm going to come out with two recordings. One is the upper recording called the systolic, and one is called the lower recording called the diastolic. Because whenever you go to a doctor, you'll say your blood pressure is 120/70. There's two readings, isn't there? Well, I'm going to tell you how both those readings happen, okay? Grab the arm here and put the stethoscope over the artery, which we're going to close off now by putting pressure here flowing here into this cuff. See it blowing up there? And as it does, the needle goes up as well. So we've got to a point now, I can't hear any sounds over that artery. It means we've blown enough air in there to cut the blood supply off to that arm. Now what I do is slowly let the air out. And I get to a point going lower and lower and lower. Here we go, 120. I can just hear sounds, and that's blood squirting in. It's still tight, but some blood's able to squirt in. At that pressure reading, the top one is called the systolic. I then ease off the pressure more. I can hear more sounds, dum, 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 and it disappears now at 74. So his diastolic, or the lower reading when the sounds disappeared, is 74. So Bob has excellent blood pressure at 122/74. So the question is what is a normal blood pressure? There is no such thing as a, in quotes, normal. All we know is the higher the blood pressure, the higher the risk of getting a heart attack and stroke. If you can keep it around 120/70, it's bang on. So Bob, you've done well, mate. You must have a really good doctor. Give me 5. there must be some frustration at some stage when you see cases through the public or private system where you know that they've just neglected themselves and there's so much that could have been done.
There's a lot of frustration, and you know, smokers, that'd be the first frustration. I mean, it's just ridiculous. It's a strong addiction, and this is not totally preventable, but largely preventable problem. And the other real frustration is with obese patients who then become diabetics, and that just fuels this whole process, and they just seem powerless to be able to deal with either the smoking or the obesity. And those two things, from my point of view, are hugely frustrating. Well, certainly, because it causes so much morbidity and mortality, and it's preventable.
So you see what I mean? We've talked about blood pressure in this video clip, and we're very lucky to have Dr. Malcolm, a top cardiologist in Wellington, talk about being overweight, diabetes, and his frustration with smokers. So the main risk factors that will put you at risk of getting a heart attack, the family history, the smoking, the diabetes, and high blood pressure. The exact sort of figures can be told to you by the practice nurse or your GP at the local medical centre. So it's really important you know about these. So if you want to be a healthy bastard, get yourself down to the medical centre and ask them, what's my risk of getting a heart attack? If you're high risk, then you can work on it.